Hi, I'm Dr. Tim.
And I'm Dr. Krish.
And welcome to the PowerUp podcast, Unfiltered. Now, what have you got unfiltered for us today?
Today we're going to talk about another fuck up.
Yours or mine?
Mine.
Hint, it's always going to be his.
Yes.
Most of the time. All right, let's go. What have you got?
I've got one. Wisdom tooth surgery.
Yes? Oh, no.
Yeah.
Oh, no.
Yeah, wisdom tooth surgery. This could go anyway.
This could go anywhere.
Yeah. Horizontally impacted 4/8. Was a 4/8, yes.
Yeah. So easy?
Yeah. Yeah, very easy. Easy access for a right-hander. Right in there. DA's on the other side.
Yeah, no one can see anything.
Exactly.
Yeah.
Raised a flap. We were decoronating the tooth initially.
Yes.
So removing the crown.
Yes.
And then started to begin sectioning. And,
Yes.
and the patient was, relatively young. He was about 22 years old.
Yeah, sure. Yeah.
Real salt of the earth. Just,
Yeah.
typical just Aussie bloke.
Yeah.
She'll be right. It was really nice. He was a really lovely guy.
Yeah, but she wasn't right.
But she wasn't right.
Right, what happened?
Yeah. Sectioning the root.
Yes.
And as I'm sectioning the root, I'm like, yep, this is going really well. My nurse all of a sudden just goes, oh, Dr. Krish, I don't know if you've noticed, but his face looks really puffy.
Yeah. Oh, no. Okay. I know exactly where this is going. Yeah.
And I was like, she was like, was it puffy before? I was like, well, it's not fat, so I don't think so. But it was just like all here was puffy, all around there.
Like cheek, forehead.
Yeah, just on one side.
Oh, no.
And we were using a rear venting handpiece when we were doing the sectioning.
Yeah, but that's what you're supposed to do, right?
Yeah, that's
you're supposed
exactly,
to not have air.
Going in.
Because we're talking about air emphysema right now, aren't we?
Yes, we're talking about air emphysema.
So you pumped air.
So for the new grads out there, air emphysema is when you pump air into the soft tissue spaces.
And it goes in?
Yeah.
But can't come back out again.
Come back out.
So normally you use a motor that has no air in it. So you can't, electric or something similar. Or a rear venting, so the air comes out the back of the handpiece. So it's not pushed into the part where you're sectioning.
Exactly.
So how did you get air emphysema?
So obviously the flap had been raised. I had turned the handpiece to the side as I was sectioning, and it's come out through the back straight into the mesial part of the flap.
No.
Because I'd done a modified Woodman, where you go around all the way to the 5.
Yeah.
And so it had gone through there and then just...
Hold on 1 second. So basically you're saying you took a rear venting handpiece.
Yes.
Which is designed not to cause air emphysema because it vents air through the back.
Yes.
Then you took the back and pointed directly into the flap and started cutting.
Yeah.
So you pumped air directly.
I had reversed that handpiece.
So you would have been better off with any handpiece.
I could have just used any. It didn't really matter at that point.
Well, no, if you use a normal handpiece, it would have gone not into the flap.
Yeah, exactly right.
What happened? You panicked, obviously.
Oh, panicked like hell. Called the senior dentist in, and he was like, yeah. This is like, he's like, call an oral surgeon immediately and see what needs to be done.
Yeah. Because those of you that haven't had air emphysema, when you feel, the one way to check is you push on the soft tissue and it crackles. It goes crackle, like cellophane almost.
Yeah. And, this guy, I took the glasses off and he was like, he looked like the Elephant Man. He just looked puffy. Looked, he really looked like the Elephant Man.
Wow. On one side.
Yeah, just on one side.
Yeah. You have this one-sided thing.
I'm a human being. Like literally just on one side. And then, so he was like, oh, it feels really puffy. And I was like, when you press on it, you could feel it all crackling.
Yeah.
So I called the Max Fax immediately, and he was just like, yeah, you fucked up. And he was just very blunt. He's just like, he's got to go to hospital. Yeah. Like, what else are you meant to do? He's got to get antibiotics, like IV, it's got to happen immediately. Yeah,
because the other worry is the air is not filtered, so there's bacteria in it.
Yes.
You put a whole lot of bacteria into a place that should be sterile.
Interfacial planes that could go straight into
and it could go anywhere. Yeah. That air could be occluding blood vessels, could go into arteries and be absorbed and cause like embolisms.
Exactly right.
So there's all sorts of things. So hospital straight away.
Yeah, thank God he's young. So hospital straight away. And I went from dentist to Uber driver in the matter of seconds. Like literally, just Thanos snap, like literally. Like my life flashed before my eyes.
You put on your other hat.
Yeah, I literally took off. I put the Uber sticker back on. I was like, oh shit, my weekend job has come back to haunt me. And I took him straight to the hospital.
So you drove him?
I drove him, and we're pretty far. We're about 40 to 50 minutes from the hospital.
Right.
The nearest. So we just.
What was the conversation in the car?
Thank God he was a Pies fan. So he was a Collingwood fan. So we just talked about Collingwood for like 30 minutes. Like I could talk for days, and he could talk for days.
Did you show him in the mirror what he looked like beforehand, or were you like?
No. I didn't show him in the mirror, but then he kept putting the mirror in my car down and looking at himself, and he was like, "Oh, look," and he started Snapchatting his mates, going like, "I've been beaten up" and all this stuff. He took
it like a champ.
He took it like a champ. He was a great bloke.
Yeah. Thank goodness.
He was such a nice guy. So took him to the hospital, and then tried to find the oral surgeon on call. I tried to fast track him as much as possible. Because
you were there, and you were wearing scrubs.
I like tried to triage him with the nurses. So I think it got fast tracked a little bit, but yeah.
And then what happened?
I called him the next day. He said, he was in the hospital till probably 11 that night. I took him at about 3.
Yes.
He got discharged at 11. They gave him IV antibiotics, and he was back at home. And he's like, I'm just resting. I'm fine.
Right. Did you take the tooth out?
My senior dentist ended up taking the tooth out.
Yeah. Just shaken.
I was too shaken by the whole thing because I was like, this guy might
kill the guy.
Yeah, literally.
Yeah. The Uber sticker might have been permanent at that point.
Yeah, literally. I was just like, what if he looks like this for the rest of his life? You're worried about the guy who got stitched up.
Yeah. This is
And so, that was a big lesson.
So what's your learning lessons for that one?
Learning lessons, I'm never using a rear-venting for surgicals like that again.
Right.
Because you just don't know when you get caught, especially when I'm not experienced enough.
Right.
Maybe a surgical motor with saline, electric motor.
Yeah.
Yeah. You can use a rear venting, but I think I need more experience.
You just need to be able to position the rear venting out of the mouth.
That's probably not what I'm focusing on. I'm focusing on cutting the tooth.
Yeah,
So when I'm inexperienced, I want to focus on the one thing that I want to focus on.
Yeah, good point.
So probably not use a rear venting at that stage.
Yeah.
And then, you can move to a rear venting later as I got more experience. But right now, I think I should have had the setup from the beginning and sort of tick those boxes early on.
Okay, so no rear venting.
Yeah.
What else?
Plan a bit better.
Yeah. Maybe look at the consequences of the stuff you're doing.
Yeah.
Especially when you do surgical.
Yeah. It can be cowboy. You can be like, I've done it the one time.
Well, there's a lot of dentists I know that get really like macho about it. They're like, I like surgicals. Yeah. And like, let me cut teeth and gums. I feel like a real doctor.
Yeah, it's a status.
It's a status symbol. Yeah. And I'm like, man, you're just butchering someone. If you can take it out cleanly without doing that, so much better.
That's true.
Like, would you want someone to like open flap you for no reason just to like prove a point? Yeah. Because you don't feel inferior for other times. So it's controversial. So we're not going to like me for saying that. Yeah. But I think it's the honest truth. If you wouldn't want it done to yourself, then don't do it to other people.
Would you want someone inexperienced taking your tooth out?
Yeah.
I mean, I know you've got to learn and start somewhere, but start small.
Yeah.
Do a sectional to start off with. Do little things.
Get some training.
Do some courses. Do the Chennai course by Johan Thomas.
Yeah, the Advanced Dental Institute.
Advanced Institute. Yeah. Absolute amazing. There's a little cheeky plug for you. Yeah.
Thanks, Johan. We hope we get a sponsorship now. We're not going to do free advertising. We do free stuff all the time.
Yeah, that's true.
Yeah, all right, cool. All right, well, good learning.
Yes.
So no more reventing for you for the moment.
No more reventing when doing horizontally impacted, raising flat surgeries. Nice. Sectionals I still do, but not for. But they're more routine for me.
And keep your Uber certification.
Yeah, he gave me 5 stars. So.
Did he really?
Yeah, he did.
Nice.
So it was fantastic. Yeah. I got to the hospital and they gave me the Uber Eats bag.
They did not.
No, I'm joking.
All right, well, my name's Dr. Tim.
And I'm Dr. Krish.
And that was another PowerUp podcast Unfiltered. If you like what we're doing, make sure you stay down for the next one.